Hello everyone, this is Leah Mills, and today I'm just doing a quick video following up on a previous video I did, which was addressing the question, is abortion justifiable to save a woman's life? Now, after I posted that initial video, many of you asked about the case of an ectopic pregnancy. And because I know how controversial the case of an ectopic pregnancy can be, in general in the abortion debate, but even specifically within the pro-life community, I decided that I wanted to dedicate an entire video to looking at the intricacies of the discussion surrounding the case of an ectopic pregnancy, and really addressing the question, is abortion justifiable when a woman is facing an ectopic pregnancy? Now, an ectopic pregnancy is where the unborn child is developing outside of the uterus, and often the unborn child will be developing in the fallopian tube, just as an example. Now, because an ectopic pregnancy is such a serious condition that pregnant women can have, while it's possible for the unborn child to survive an ectopic pregnancy, and there have been documented cases of this happening, the reality is that it's extremely, extremely rare. So when it comes to the case of an ectopic pregnancy, my response as a pro-lifer is that the woman needs treatment. After she talks with her doctors and explores all her options, it's her right and it's our responsibility as a society to provide her with any treatment that's available and that would be helpful for her in the case of addressing her ectopic pregnancy. Now, the treatments provided as a solution to an ectopic pregnancy do end the life of the child, and that's tragic. That's an unintended side effect of the desire to save the woman's life. But since it's not possible in the case of an ectopic pregnancy to save the life of the child and the life of the mother, our focus and the focus of the medical community must be on saving the woman's life. Now, when it comes to treating an ectopic pregnancy, for example, a pregnancy that's developing inside of the fallopian tube, what will often happen is either an incision will be made in the fallopian tube and the unborn child will be removed, or the entire fallopian tube will be removed with the unborn child in it. And so in both of these cases, the goal is to save the woman's life. Unfortunately and tragically, the unborn child's life will be lost. But it's important to remember that when it comes to treating an ectopic pregnancy, the goal was to save the woman's life, and the unintended consequence was the loss of the life of the child. That's extremely different from an abortion, where the goal of the surgery is to kill the child, and then afterwards the woman is treated with the appropriate treatment for her condition. While many view ectopic pregnancies as kind of the trump card to justifying abortion on demand, when it comes to an ectopic pregnancy, the surgery that we're talking about is not an abortion, which just goes to prove my statement in the previous video that abortion is never medically necessary. The reality is that abortion ends the life of a child. It does not benefit the mother in any way, shape, or form. And so when we're talking about saving the woman's life, which is my desire as a pro-life individual, as a traditional feminist, when it comes to saving the woman's life, an abortion is not the solution. And so because abortion is never medically necessary, abortion is not justifiable when it comes to saving a woman's life and when it comes to the case of an ectopic pregnancy. Do we need to treat women who are facing an ectopic pregnancy? Absolutely.